leader of Okata Wellness Solutions, and I'm also part of the HPC. How many of you know what HPC is? HPC is Health Professional Council. So at any one point you see me, please come and consult, especially about the product only, okay? So it is important for you to understand that there are people like that who can stand and help you with the products. So straight to our topic of today, we are going to be understanding what hypertension is, so that you who has somebody at home and you have no idea the basics you're supposed to do, this is for you. Are we together? Can we read it together? 1, 2, 3, let's go. Beautiful. We are saying where the force is defined as the pressure defined as the condition, the force of what? Of blood against the walls of the artery. Are you together? So I want you to understand what hypertension in detail today. Forget about the heart meanwhile. Are you together? Now, this is what you're saying. It is the force against the walls of the artery or the veins. Are you together? But also we are saying it is referred to as a silent killer. Do you know that you could be having high blood pressure for so many years until then, in the late 40s, 50s, 60s, that's when you realize that you have what? Hypertension or high blood pressure. Are we together? These notes you're going to get them, so make sure you just highlight the main points. Are we together? Let's go straight. This is exactly what you're talking about. We've just read the force along the what? Along the artery. This is an artery. This is a cross section. They've picked a whole round artery and they've cut it. Are you together? But they're trying to indicate for us the force along the what? Along the walls of the artery. And that's what you call high blood pressure. Are you together? Don't run and go and do a heart transplant. Are you together? Don't go and run and do this because you're caring for the heart. But understand what is blood pressure first before we can go to the heart. Okay, so let's go ahead and we see. Some statistics says about 7 million people, 700 million people. Are we together? This is quite a very big number. They struggle and suffer with hypertension or high blood pressure or pressure. Are you together? We might say hypertension, we might say high blood pressure, when you personally know it as pressure. This is what is locally pressure, actually, not even pressure, pressure. Are you together? Yes, so they're saying approximately 45 adults have high blood pressure. That's according to the disease for what? Disease for control and prevention. Okay, but they emphasize that there are factors, risk factors for the cardiovascular diseases, which among are the leading cause of global death. They are risk factors. They are what predispose you to getting high blood pressure. And this contributes to death globally. Are you together? And that's what you call pressure or high blood pressure. Look at that. We're having a bit of what we call a prevalence rate of hypertension according to the threshold of about 140 over 90 or 130 over 80. This is basically the pressure you take. And you're seeing, if at all you've taken pressure, you're going to take it according to what? To the age and also sex. Are you together? Look at between 18 to 29. It seems to be basically normal. There's no stress, there's no pressure here, there's nothing. Okay? Look at male. See? 4.1%. Look at female. Basically, ask the men. I wish this room is actually full with men only. It would be better. The age of 30 to 39, you see that's where a lot of other factors are coming in. The number is increasing. Look at what males are actually presenting with. Look at the females. But again, when you get the average of the two, then what you get is the yellow one. So you get both sexes and we get the average, and that's what gives us the statistics of the yellow. Look at 40 to 49. Where do you lie? Somewhere, somehow, majority is between 30 to 39. Okay? So you know that by the time you're advancing in your age, there are higher chances your high blood pressure will also increase accordingly. Look at 50 to 59. Look at what males are struggling with. A number of males, a number of men are struggling with high blood pressure, but there are moments they're not even aware about it. So look at female. But then when you get the average of the two, it gives us that number. 60 to 69. People are struggling at this point. 70 to 79. You realize at this point, almost everybody has high blood pressure. Almost everyone is struggling. Almost everyone is on their medication. Why? Age is another big factor to high blood pressure, as you're going to look through. Okay? This is a bit of a graph that shows how we vary with age and also with sex. Okay. As the layman, let's look at the basics. I don't want us to go into detail because you're not going to do examination. But I want us to understand what are some of the basics that you, as a person, would understand about high blood pressure. What do you need to do in any case you're taking high blood pressure, even your own? And what do you need to even have before you even say, I'm going to take I'm going to take my blood pressure? Are you together? So, there are terms, what you call physiology of blood pressure. This is what you call systolic, or the systole. Okay? This is what increases when the heart contracts to pump blood out. Can you do like this? Open your hand like this. Just open your hands. And then squeeze it. Open again. Squeeze it. Increase the what? The number of times you're opening. Are you seeing? There is that opening and squeezing. So we are saying systolic is when the heart contracts. The moment it contracts like this, that means it's what? It's pouring blood out. Okay? That's what you call a contraction, and we call that systolic. And that is the higher blood pressure that we talk about. Okay? And then there's what you call diastolic. This maintains during the heart resting phase, allowing the heart to refill with blood. Understanding? So you're saying the moment we contract, then there's going to be that kind of opening. And the moment it opens, then it will open the valves for blood to do what? To enter inside. Do we pick the points? Beautiful. So, before we go further, I would request Hassan or anybody next to play for me. This is a video. Somebody play for me the video from the laptop. If Hassan is there. Anybody next to that door, please. Fridaus, kindly play for me this video. Don't go away. Just stay there. Are you seeing what's happening here? I want us to note some things. Just take a look at what is happening in this video. Play it once again. I want you to understand the contraction and the relaxation of the heart. This is the heart. This is a photo of the heart. Are you together? So you realize the moment it opens this side, blood is pouring. Are you together? And this thing closes. Play it again. This closes. This is a valve. It closes, then after contracting, it pours blood. And that's what happens in our life from the time of conception. Are we together? And that continues over and over and over. Thank you, Fridaus. Can come back and sit. Let's give a big round of applause for her. And the systolic is the pumping, okay? The pumping of blood to get out. But then the diastolic, this diastolic is now the filling of the heart. Are we together? Are you understanding? Do you get the concept now? Now, because why I brought this, I don't want you to get confused. We're going to have a lot of relationship with that video, okay? Great. So, blood pressure readings. Now, where the systolic and the diastolic are now coming here. Are you together? Normal systolic. We say when you're taking blood pressure, there is the upper one, which is the what? The contraction, and then there's the lower one, which is the relaxing. Are you together? Then you're saying for it to be normal. This is now one thing you don't have to even miss in your notes. If you're taking notes, this is a point to understand. Because if someone asks you, what is my normal blood pressure? What should I consider to be normal? Where should I start worrying? 120 millimeter mercury, okay? That is a systolic, and diastolic of 80. That's what's called normal. When you take, I didn't carry my blood pressure machine. We would have a sample of one person here to take their pressure. But again, we are saying there's also what you call an elevated systolic. Elevated, sometimes you could have been doing a lot of hard work, maybe doing a bit of jogging, walking, and then all of a sudden, when you take your blood pressure, it exceeds 120. Okay? So, and the diastolic of 80. Are you together? This is what you call elevated. Like it has slightly risen up. Okay? Then hypertension stage. Now this is where our concern is going to be. Anything that ranges from 130 to 139. And not only on one single test, it's on several tests. That's when you realize that, why am I having only 130, 130? Okay? And then 80 to 89, that's the downer ones. Hypertension stage 2. Anything that goes to 140, and the lower one of about 90 and above, then there's a question there. Are you together? When you do a test, and this should be for every distributors. I asked this when we were doing Zoom, how many of you people have a blood pressure machine? Thank you. Let's give a big round of applause for our great upline. That is Abdul Aziz. The gentleman is the only person in here. Any other person with a blood pressure machine? There's nobody. This gentleman deserves an award. So everybody, for as long as you're a cell leader, you are a distributor, you are an IBO, whoever you are you together? Blood pressure is mandatory on each and every one. And each and every household should have blood pressure machine. It is very affordable. Are you together? Now, you cannot learn this when you don't have the physical blood pressure machine. There are those that are automatic, there are those that are manual. Are you together? Just get the automatic one, put the cuff and sit there. It will definitely read and give you results. As simple as that. But if you don't have that, understanding this won't be easy. Are you together? So it is very, very important. We follow our what? We follow our leader there. Ladies and gentlemen, let's go forward. Primary hypertension. There are now types of blood pressure. They can say maybe this is a non-hypertensive person, maybe this one has just got this blood pressure. But they're saying no identifiable cause. It develops gradually. Like you have no idea how, where, when, how did I get this? Are we together? That's what we call primary hypertension. Like you cannot explain. No family history, no history of maybe stress or this, but you find yourself developing pressure. Are you together? Then there's what you call secondary hypertension. And these have underlying what? Causes. Look at the association here. There's a kidney what? Problem. Then you also say hormonal imbalance. Ladies, are we together? This is what we call pregnancy. I was going to talk about pregnancy-induced hypertension. Then there's what we call mental illness. Are we together? All these can lead to what? To hypertension. But now this one, they already have an underlying cause. This somebody has has kidney disease, somebody is pregnant, somebody probably has mental-related conditions, or any other chronic condition that can predispose them to having high blood pressure. But meanwhile, the primary nothing, you're healthy, and you find yourself having high blood pressure. Are you together? And that's where all of us fall victims. Are we together? Beautiful. So, we're going to take a case study here. We are taking an example of a patient with secondary hypertension. What did you say about secondary hypertension? You say that louder. It has an underlying condition. Are you together? So if you say a case study of a patient with secondary hypertension, that means it's already a what? Underlying condition. I want us to understand very well. Due to renal artery stenosis. Involves someone with severe hypertension who presents with symptoms like Are you seeing those factors? Now those are some of the factors that are contributing to his high blood pressure. Are you together? But this is a scenario. Let's see how we're going to manage this. Imagine you meet such a person, you who's a layman, but you have that history. Okay? Now, secondary hypertension due to stenosis, patient profile. This is John Sebuma. Not. And then, the age, about 58. I want you to look at the history, chronic condition. I want you to look at the age. Are you together? Those are now the contributing factors. When you take this, how old is this man? 58 years. Do you remember our graph? You remember the 50s and above where they lie? Beautiful. And then look at the what? The sex. You remember sex as a factor? Beautiful. Then let's take history here. Hypertension diagnosed 5 years ago. This person has already had hypertension 5 years ago. Who was with multiple antihypertensive medication. Are you together? So you realize that you have this mother or grandfather at home. They have been on so many medications. You go and buy for 1,000, for 2,000 for a day. Are you together? Now, we are saying he's also having high lipidemia. Okay? No known history of diabetes. Look at that. The person is so diabetic. And then we are saying chronic kidney disease. Now, why chronic kidney disease? You realize that the person had renal issues. Are you together? Then they're saying the chronic kidney disease at stage 2, and this was diagnosed 1 year ago. How are we going to manage this person? I imagine this is an examination anyway. What would happen? Say, Boma, what would be your approach? Anyway, let's go ahead. Presenting symptoms. How would you know this person is now badly off? We're saying John presented to the outpatient clinic. This is let's say maybe a facility. Okay, if not that, you've gone for an outreach. Okay, you're experiencing such kind of client. You're saying John presented to an outpatient clinic, persistently elevated blood pressure. I told you about the elevation of the blood pressure, reading averagely 180 over 110. But then, despite being on 3 antihypertensive medication, they've given the different medication. Occasional headache, mild shortness of breath, and exhaustion. Those are symptoms. How this person saying, Pandange, I am not feeling fine. My head is always aching. I am not seeing very well. My vision is blurred. They are presenting a problem. Are you together? Now, let's take the family history. Father had a history of hypertension and coronary artery disease. Mother had a history of kidney disease. Are you together? Look at the relationship in those. We are going to do physical examinations. It doesn't mean you have to really go deep and touch this person. There are very vital signs that you can see. We're going to take the blood pressure. That's where it is very important. For whoever is going for an outreach, carry your blood pressure. Carry it along. Number one, these people go out taking their blood pressure at a cost. You are providing a service at free. Okay, at free cost, no charge. Take the blood pressure, and it's 182 over 112. Heart rate 80, respiratory rate 16 breaths per minute. General appearance, the guy is fat. With that BMI results. It appears in mild discomfort. You would see there's a bit of pain. There's a bit of a discomfort there. Cardiovascular system, regular heart sounds, no murmurs. Pulmonary examinations clear, this might not be necessary for you. Abdomen examination, soft, non-tender, and this is not necessary for you because you're not going to touch those areas. These are for medical personnel. Now, extremities. Chances are, do you know what extremities are? Extremities are these parts of your body, these and the legs. Okay? The feet, these are what we call extremities medically. Now, when you look carefully, it is not presenting with edema or no swelling. Those are physical examinations. Even if you're prescribing your supplements, whatever you're prescribing, look forward for those symptoms. Like, does this person have this? Does this person present with this? In any case, they present with this. What should I do? Are you together? As a layman who is willing to help out. Let's go ahead and see. Laboratory tests might not be really necessary for you, but complete blood count, basic metabolic panel, creatinine, and the rest can be done. Lipid profile. Now, this is what reveals what we call cholesterol. Some people call them bad fats. There are no bad fats in the body. Are you together? There are no bad fats in the body. Only that the level is slightly higher and the body does not need it. Because the cholesterol we talk about, there's what we call low density lipoprofile and high density lipoprofile. But these are fats that are necessary. That's why when you see your skin, you move and walk, you sweat, and there's a bit of fatigue that comes up. Are you together? They're actually necessary. The fats that we say are bad fats, they're also good fats that are necessary for the body. But how much is what matters. So, these are the tests when they'll tell you to go and take your cholesterol test, and this is how the results will come out. That is what he has. Then urinalysis, they're saying no protein or anything in the what? No protein and blood in urine. Now this is our patient, this is John. How are you going to help John? Image has been done, CT, several tests are done. Renal ultrasound scan is done. Then diagnosis. What could be John's problem? We are saying primary diagnosis, secondary hypertension due to, are we understanding? Initially we were saying it is because of underlying condition. And now we are saying this pressure is coming because of the renal artery stenosis. What are some of the contributing factors? We're saying chronic kidney disease. Are we together? Now, they are already underlying condition, but what are some of the factors that are speeding up the blood pressure of this person? Great. Management. We have two major ways we are going to manage. Number one, we manage with pharmaceutical medications, which is not your part. Number two, we are going to manage lifestyle and the rest, which includes diet. The pharmaceutical medication, please don't prescribe. You'll struggle with the dosage. Now, lifestyle modification. Talk about diet. Implement low sodium diet and increase on potassium intake. If renal function permits, only depends on how the renal functions report is. Exercises, this is mandatory. You see, like everywhere, we keep talking about exercises. Okay? Why? Because we want to shed off some of the weight. You remember the BMI? The person was already obese. Encourage exercises. Limit alcohol intake. Are we together? Now, these are lifestyle modification. You can actually modify all this. and you know that if it is a primary cause, I mean it's a possible cause, then chances are you can modify that. Then the third one, referral to neurology. Are we together? This is another way of management. This is not our part. We are going to go down to follow up. How often do you even follow up? Leave alone even hypertensive patients. How often do you follow up? One person you've given your, let's say maybe super focus. Are you together? So follow up. Do you agree with me that follow up is actually part of management? Yes. Absolutely yes. So that means every single person, you give a product today, put them in your list. 3 days later, check out of them. 1 week later, check out of them. 2 weeks later, find out how they're doing. What if they're normal? And you're only calling after 3 months that, hey, have you finished your medication? I have more for you. Are you together? So start the follow-up on the very first instant time you get engaged with this person. Regular monitoring of blood pressure, renal functions and medication are there. As in this case, this is for the other joint client of ours. Are you together? But again, initial follow-up visit in 2 weeks to re-evaluate blood pressure. This cuts across any other person you're taking care of. Even if they're healthy, they're just looking forward for their what? For their health. It is important to check out on them almost every 1 or 2 weeks. Now, this is not left and right. Are we together? This is not left and right. Now we are saying a short flow of some of the causes of blood pressure. Initially we say there is essential or primary. Okay? On your what? On your left. For you to be on your right. Then on the other right there is secondary. Are you together? So you realize this does not have their downlines going. They are very dormant. They are not presenting. Are you together? And on the secondary hand, they have been given a spillover. Are we together? So you realize at this point there are so many factors. There are other secondary causes to hypertension, so many. And there are others, so many. Are we together? This all ends up causing secondary hypertension. That's why you're saying they have underlying cause. There is something that brings about high blood pressure, and it goes deeper and deeper as a strong leg. Are we together? So that's about the primary and the secondary, and that is a short flow that shows that yes, this has a known cause and the other one has no known cause. Okay? Are we together? Yes. Are we learning? Yes. Beautiful. So what are some of the risk factors? Risk factors could not necessarily be what causes hypertension. Do you understand? That at any one point, I jump and I keep hanging on this door. Chances are, on this window, chances are I can do what? I can fall the other side. That's a risk factor. Of me playing around there, it's very risky for me to play there. Maybe in the end I might fall the other side. And the same thing we are bringing here. Possible causes or the risk factors. Modifiable factors. Are we together? Modifiable factors means things we can change, but we are intentionally sticking on them and we don't want to change them. What's point number 1? Unhealthy diet. Are we together? High sodium and low potassium. Physical inactivity. How often do you even go for a gym? Fridaus told me she does gym often, which is a good thing for her. How about you? Stairs, the same stairs down here. And the stairs they climb when they're holding their waist like this, as if they're reaching, as if they're not reaching. Physical inactivity, you can modify that. There's nothing much than taking 5 push-ups every single morning and every single evening. There's nothing wrong walking from here up to Wandege and get your tax from Wandege if you're going to Gayaza. There's nothing wrong getting out from here when you're going to town and you walk. Are we together? And above all, there is nothing wrong when the office is closed on Sunday for you to go at 3 p.m. to about 4 p.m. doing a drill. So how many are actually doing that? Are you together? So that means the modifiable lifestyle, we are the ones that actually intentionally not doing it. So if we change it, chances are we can get out of that risk. Obesity. Let's avoid seeing Farida struggle all the time, teaching people about what? Shedding off their weight. Are you together? Yes, it can be money making, but never allow yourself to grow fat. Obesity is one of the biggest risk factors for hypertension. And people can know, you can actually know that, yes, I am getting there. But they still adamantly refuse to do what? To take care of their what? Of their weight. So they're saying obesity is the biggest and is one of the risk factors. Alcohol consumption. Okay? Here we can say in an environment like this, you wouldn't know who drinks, who smokes. Okay? But it is a modifiable lifestyle. You can change it. Then tobacco use, I talk about that. Stress. Who believes you can change stress? You can modify your stress level. The adult is demanding, left and right is not moving, products are not, downlines are quitting, together. And I come and straight I tell you, modify your what? Your stress. Don't get stressed. Are you together? Now, what happened? We have stress levels. Okay? And the moment you stress, there's what you call a stress hormone. Are you together? And the stress hormone, when the moment they keep constantly coming, then trust me, your life is going to be at risk. And it's one of the factors that can push you toward high blood pressure. But you can modify it. What do you need to do when you're not selling? Increase the what? I saw on manager's status today. So he was saying, if you only approach the poor, please make sure you also advance to the what? To the rich who can buy. Right together. And then sell to people who actually really need your product. Okay? Don't sell for people who come and ask how much is it. And you tell them it is 9 ticket, the blue ticket, they disappear. Again, you post another one after 1 week, they come and ask how much is it. Are you together? So, we are saying you can modify stress as well. Now, do you remember our John, our client? Then you're saying non-modifiable factors. Factors that you cannot change. Are you together? That's why today, I think today going forward, it should be very clear to you that hypertension can come from any source. Me being modifiable or non-modifiable. Now, this is something we cannot change. If it is running in your families, chances are you can also have the same. Are you together? Age. You would agree with me that in our case study, the gentleman was aged, because it's about 54, 58, I think he is. And then family history. If you know very well, if you remember very well, the mother had kidney disease. The father had history of hypertension. And these are factors that you cannot change. And even when you are recommending a product to somebody, give them a highlight. Say, you know what? These are some of the possible causes of hypertension. Where do you think could have been your cause? So it is easier for you to help them because these people are desperate. All they're looking for is a solution. And the solution is for them to be free. And you know very well, theirs is non-modifiable. And you tell them they're going to be perfectly fine after 1 week. Are we together? So what you do, understand what is causing their blood pressure. So it is easier for you, number one, to reassure. Okay? So it is very important for you to tell them, you know what? We are going to manage your condition. We are not going to treat, but we're going to manage. Okay? Are we understanding? Ethnicity. Okay? There are categories that particular groups of people who have high level of blood pressure in their communities. Are you together? That's why when you keep taking blood pressure from one person to the other, you realize that almost everyone has the same. And this also cuts across, and you might find because of the family history, the same people with the same kind of lifestyle, the same kind of categories of people, I mean. So those are some of the non-modifiable. Even if you do what, you cannot change anything about it. Now, a chart showing modifiable versus non-modifiable risks. You realize that the non-modifiable risks is actually much more, and it's overweighing us. This is your heart. And it's saying blood pressure, of course, definitely affects the rhythm or the pumping of the blood. But then the non-modifiable risks. Look at this in green, in blue. Race, ethnicity, age, gender, and genetic factors, and probably high blood pressure on its own. Look at the green. You see what we can actually do. Probably, maybe you can reduce all this green, and it turns out on the other side. If we work on this green, you realize that the level or the number of people struggling with blood pressure will be low. And in this case, you're saying modifiable risks: smoking, diabetes, physical inactivity, obesity, high cholesterol, and then the blood pressure itself. Can't we control smoking? We can, isn't it? Can't we control diabetes? We can. How about physical inactivity? Actually, by now, we should even all be running around in this house, looking forward to control. Are we together? Then, obesity. We can control obesity, definitely. And then high cholesterol. These are factors that you can kick them away. And that's why they're saying they are the modifiable. The factors that you can easily change. Are we together? Yes. Kata. We are now sleeping. Okay, let's go ahead. Like I said earlier, the slides are many, and you need to know them because they're most important information at the end of it all. Heart complications. Look at the consequences of untreated high blood pressure. A number of times, people will run to us, okay, saying, please, can you try give me this? Earlier in the morning before I came for this training, somebody called me from Congo, and they've been there for long, having high blood pressure. And a situation where the systolic has got to 210. And the diastolic is 110. Are you together? So we are saying they are poorly untreated high blood pressure. You already know you have your the modifiable cause. It was from the modifiable cause. Okay? Maybe obesity, maybe inactivity or anything. Now, heart complications. It ends up with heart diseases. There are other heart diseases that are not necessarily blood pressure. Do you agree with me? For example, are you together? Okay. Have you ever had somebody's valve gets blocked and they're supposed to go and do operation? Are you together? And those are now complications of what? Of blood pressure. Look at stroke. If we go into the science of how stroke happens, then you would understand that it is important for you to control your blood pressure. The brain is filled in our head, but every part of the brain has its function. The front has its own. Here it has its own. At the sides it has its own. And then the back and also the root of the what? Of the brain. But for as long as any part is affected, let it be here, you are going to get stroke. Why? Because maybe the artery is blocked. Or maybe there's been rupture of the what? Of the veins. And then you realize you lose sight from maybe no longer speaking, maybe you get confusion, and then you're also having stroke. Kidney failures. Okay, eye issues. Do you know that the eye also has its own pressure? Yes. So the moment your eye has pressure, chances are it will get complications as well. An example of unmanaged pressure is stroke resulting from unmanaged hypertension, which is often referred to as hypertensive stroke. Are you together? You have poorly managed your stroke, your pressure, and then it leads into what you call hypertensive stroke. This can be classified into two main parts. This is what you call ischemic stroke. I think I hinted on this. Ischemic stroke is basically caused by a blockage. Okay, any blockage along the flow of blood to the brain through the veins or the arteries, and then ends up with what you call ischemic stroke. And then there's what you call hemorrhagic stroke. Maybe could be from accident, or it could be from a rupture of a blood vessels. The heart pumps blood close to about 4 to 5 liters to the brain in 1 minute. Are you together? But then, for as long as there's any slight blockage or redirection of blood, then it causes problem to the brain. And the only result is now stroke. Are you together? So you're saying those are two major causes of stroke. And you see someone has got stroke, they will rule out these two causes. Okay? Let's go ahead. Some of the photographic interpretation of what exactly I'm talking about. Are you together? You already having a system information. You already have stroke there. Okay? The stroke could be out of infection, could be any kind of vascular dysfunction, could be out of diabetes. And before you know it, it gets back to. And this only comes as an unfavorable outcome of stroke. Are you together? So let's take a photo of it. Okay, 3 seconds for those who are taking photos. Great. So we're saying this is what we call an infographic depicting the virus complication and their interrelationship. There is a relationship between this and stroke. Are you together? So at any one point this happens, chances are it might end up in, this might make you end up in stroke. Are you together? So, diagnosis, how do you diagnose? How do you say that somebody? We already had a hint in our case scenario. This seems to be a repetition. Office blood pressure measurement. How often do you measure your blood pressure? From here anyways. Are you together? It is important you get to understand and measure often. Then, what you call ambulatory blood pressure monitoring. There are some particular types of machine that you just attach it on yourself. Okay? The moment you attach it, it keeps monitoring your what? Your blood pressure. Then the most common one is a home blood pressure machine. Okay? So it is really upon everyone to look forward for what? For this home blood pressure machine. Okay, so we're saying a checklist graphic that details the step taken during blood pressure. If you're taking blood pressure, you don't just take blood pressure. There are steps. Are you together? You cannot take blood pressure while standing. You agree with me? You can't take it while lying down. The results are going to be totally different. I'm not going to go through them one by one. I think the resolution is high. I can't display here. But on your phones and the laptop, it will display very well. Okay? It is important. Look at this photo. Okay? Let this person sit comfortable. And preferably use the left. Okay? Why do you think you have to use the left? Pardon? Yes. Let's clap for her. I think wise people are always sitting in front, isn't it? It is basically where the heart is located. And when you're putting the cuff, this is what you call a cuff. This thing we put at the arm. Okay? Oh, another point. When you choose to buy a blood pressure machine, buy what you call the upper arm. There's a machine we test from here. Then there's another one that is from the wrist. Preferably do the upper arm. And when you're testing, let the person sit comfortably with the chest up and the hands on a table that is supported. But again, the cuff should be at the level of the heart. Are you together? The legs should not be like this. Because why? chances are you could be blocking the blood flow. So we want to really understand, is this high blood pressure or because the legs were actually crossed and blood was not moving well? Okay? Beautiful. Ideally, really use a validated upper arm electronic device. Are you together? This is what is preferred. But in situations where you cannot avoid it, that's when you can use the other ones. But that is some of the checklists how you can organize your center. So if you're going forward for what? For an outreach, set up a place like that. Are you together? You can set up a place like that, and as people are coming to consult you about the medication, they can equally consult you and you take their blood pressure. Are we together? Yes. Beautiful. Okay. Our management. Now we are about to take it down. Okay. So lifestyle changes. It's okay. We talked about the lifestyle modification. Are we together? Number 2, diet, and that's where our main focus is going to be. Adapt a Dutch diet, fruits and vegetables, whole grains. Every other person who is doing products, the plan, you realize, not the plan, but when you're talking about the products, okay, you realize that people keep talking about, or maybe talk about 7 servings of fruits and vegetables, talk about this and that. Here we are saying adapt fruits, vegetables, and whole grains. But you realize that we keep talking about this over and over, that it's so hard to do the 7 servings in one day. Exercises. They're saying how many minutes? How many? Of moderate aerobics per what? Not per day. Per week. Do you see how easy it can actually be? Get 150 minutes, divide it into 7. Are you together? And when you divide it into 7, you know how many minutes you need to take per day. If that becomes harder, take that minutes and divide it into what? Into 24. You will have no excuse that I work a lot, I do this, I do that. Seboma is calculating for us. So tell us, what is the result you got? I saw you were calculating. Minutes. Not even one. Are you together? So you realize that it is so easy for us to do these physicals. Weight loss, even a modest reduction in weight can help. There are people who sell weight loss products here, right? Yes. Most of our clients are looking forward to reduce on their weight immediately. That's not how it should be done. We're saying even if it is the slightest, the smallest, it still can help. So whoever is obese, advise them that continue practicing and doing the same. Then limit alcohol or do it in moderate consumption. Then quit. There's no negotiation here. Here they did not say limit or reduce. They said what? Quit. Just completely stop it. That's for the alcohol. Okay, let's go ahead and you see. Balance what is lacking. Every other person has their own. So when whatever is comfortable or whatever is lacking on my own plate might not be yours. Are you together? So my lifestyle, somewhere, somehow, you might find me, I'm doing a lot of what? A lot of processed food. But what am I going to do behind that? Are you together? That's exactly what you talk about. That the moment they're saying balance what is lacking, every person has a unique nutritional gap. You're not even doing supplements. But every day on your chicken and chips. Are you together? Every day you're on soda. Are we together? Every day you're on chikomando. Every day you're on chapati. Are you together? You realize that your nutritional gap is really wide. Me, I would say, I'm going to take what? I'm going to take chapati. I'm also going to do my KFC. But when I go back home, I don't forget about my omega. Do you see the difference between the two people? There's this one who is intentionally taking what? Themselves to their grave. But then there's this one who is saying, I'm going to the grave, but let me do something about it. Are you together? So that's where they're saying, we have what is lacking, but every other person has their unique nutritional gap. So what is yours? Are you together? Okay. And that's where we get all this. Ladies and gentlemen, so much thankful to Okata Wellness Solutions. This can detox, it can protect, it can balance what is lacking, it can boost your body's defense system. So that even when you're lacking a lot, this can actually cater for your what? For your problem. Are we together? Ladies and gentlemen, that brings us to the heart. Protect the heart. It is the heart. Here is what I'm saying. Your heart is the most important muscle in your body. It never stops working. Pumping oxygen-rich blood to every organ, tissue, and cells. And lastly, the saying. Can you read it together? Do you know how powerful that statement is? Every single heartbeat is what is keeping you alive today. And for as long as the heart stops beating, then we hear people crying. Are you together? So make sure you do everything possible for the heart to do what? To beat or to pump. So ladies and gentlemen, when blood vessels narrows, the heart does what? It suffers, and it does not suffer small, it suffers big. When the blood vessels narrows, the blood suffers. Look at this. This is okay. Maybe this is where we are right now, and we are advancing in our age. But what if it starts narrowing like that? And that's where suffering starts. And it might not end anytime now. And we are saying, when your blood vessels are clear, blood flows easily. Simple. When they become clogged with bad fats or with cholesterol, we didn't say it's bad fat. Are you together? With cholesterol, blood flow stops, or it narrows, or it slows down. The moment, and what are some of the factors? We talked about many of those factors. You think a fat person, you think their vessels are open? Do you know they are fat because they have a lot of fat on them? And you know that fat actually compresses or suppresses on the what? On the blood vessels, and they end up narrowing. And then the blood flow will reduce or slows down. And that's where you give rise to what? To blood pressure. Are we together? And then this puts at a risk of hypertension, heart attack, stroke, and many more other complications that come with high blood pressure. So, ladies and gentlemen, that brings us to a point that super omega-3 is a savior in this case. And they're saying our solution to do what? Can you read it louder? And this was supposed to be the right time we were supposed to do our practicals. How many of you have ever seen a practical with omega-3? Okay, basically the old boys and girls. So the new people, you don't know what omega-3 does. Is that true? Yes, so it's a responsibility. I think those who have not seen, it's a very, very powerful product. It's a very powerful product that the moment you see the practical physically, then you would believe and start using it immediately. Okay? I don't know how best, but maybe the next time you organize, or we can actually organize an evening and we sit together maybe on around what? And we do a practical and we see how this product works. Are we together? Beautiful. So, I will sing a solution to unblock your arteries and then protect your heart. Our omega-3 is high concentrated in what? High concentration of omega-3, that's non-standard fish oil. Why we say so? It helps clear your blood vessels, support heart health, and reduces the risks of hypertension, heart attack, and also stroke. Beyond the heart, it nourishes the brain. It supports joint flexibility, enhances skin glow, improves vision, and also strengthens immunity. Are you together? So all that are the importance of omega-3. But today, we're going to narrow it to what? To the blood vessels. Okay? So, super omega-3. Let's look at it, an overview of what super omega-3 is. Okay? High potency dietary supplements that is derived from fish oil. You know very well that it's from fish oil, isn't it? Yes. Beautiful. And then it has what's called alpha-linoleic acid, and it provides cardiovascular, neurological, skin, hair, joints, and health benefits. And all that are from the super omega-3. But again, key ingredients, fish oil. We talked about that. We said it's from fish oil. It's basically from fish. Improves heart health, lower triglycerides, and also offers anti-inflammatory properties. Most people suffer. Actually, what kills people is inflammation. Why? Because the moment the body detects something not right, it responds. And that kind of battle they have is a big problem. And also we are having what you call EPA. Understand your product. Get your super omega-3 in your hands. Get what is that amount of EPA. And what does EPA do in the body? It reduces inflammation, improves heart health, and also supports mental, and also avoids the risk of cancer. Are you together? So understand, okay, there are so many other omega-3 in the market. But what do you have that is so special that can make you stand out in your product? Do you know what quantity of EPA that is in what? In your product. Are we together? So, it has about 200 milligrams of that particular EPA in it. And also, that's part one. Ingredient part two, it has got what we call DHA. Are you together? Now, DHA supports brain development, eye health, reduces symptoms of depression and anxiety. It also has vitamin E. Why do you think we are saying it is good for skin? Vitamin E is one of the best for your skin. And it's a powerful antioxidant, protects cells, enhances cardiovascular health, and improves skin and immune system as well. Let's look at ingredient number 3. ALA. Now this one converts EPA and DHA. Does that make sense? What happens? They get this ingredient and you swallow the capsule. Okay? But now, it is this ingredient that has to convert it to what we call the EPA and the DHA, which is going to be very useful for your body. That means if it is not there, it might be harder for it to be converted to the EPA we talk about. And this basically boosts protection, improves heart, skin, and also athletic performance. This is what we're talking about. You see this? I think this is the second time we're talking about this. What happens? We have cells. Can we say together cells? What are cells? Smallest unit of the body. As simple as that. Now we're saying this is a cell. This is where almost everything starts from. But again, we are saying we are often and frequently being attacked by free radicals. The lifestyle we live, whatever we go through. A normal cell has got 2 molecules and it is balanced, it is okay, it is healthy. Life is going on well. At the moment the free radical gets in form of whatever you call it, infection, whichever way that free radical gets in your body, it is going to look forward for a molecule. And free radicals always comes when their molecules are not balanced. See? So the fight is, can I grab one from the normal cell? And that's where white blood cells and the rest comes in and they start fighting. And if they overweigh your cell, what happens? You start falling sick. The symptoms of sickness that comes in. You rush to the hospital and they tell you have this, and that. But what are we looking at? We want antioxidants. What is the use of an antioxidant? An antioxidant is going to say, please calm down free radicals. Are you together? I have so many of these molecules. Can I give you some? And then it neutralizes the effect of the free radicals. Are you together? And do you have a reason to take so many of antioxidants? Who is taking respiratory? Okay. Why am I seeing only people who are advanced in age? Anyway, very good for everyone. Are you together? So that is how antioxidants works. We look forward to neutralize the effect of free radicals in our body. Ladies and gentlemen, for the skin as well. Why use super omega-3 part 1? Why? Is it important anyway? Lower cholesterol, cardiovascular health, and also mental health. We talked about that, isn't it? Why use super omega-3 part 2? Inflammation and support joints as well. Reduce symptoms of arthritis, fibromyalgia, and also lupus. Skin, hair, and are we together? So not only you use hair, skin, and nails, but you can also add in super omega-3. When you're giving your products, give it in combination. And the moment you give this plus your hair, skin, and nails, there are chances that this person will be glowing more than expected. Are we together? Yes. And also target market. Who can actually use these products? Age 8 and above. But younger ones can use. If they cannot swallow, get the capsule out and squeeze them in their favorite meal. They can still benefit. Pardon? Favorite meal. Not milk. Favorite. Anything they prefer to take and that. But of course there's that kind of fish smell. But it's not because who doesn't eat fish anyway? If you don't eat fish, then maybe it's not what? Another says doesn't eat fish. Are you allergic? Because of the smell. She does not eat it just because of the smell. Then you need to swallow. Okay? You just need to swallow this. Then, gender. Suitable for both male and female. Ideal for individual. Focus on cardiovascular and also neurological and joint health. Ladies, are we together? Yes. Are we together, ladies? Yes. Can we read that point louder? Pregnant mothers and fitness enthusiasts seeking health and recover. Are you together? And also breastfeeding mother. Do you have breastfeeding mothers in the house? Oh, yes. Yes, if you're a breastfeeding mother, you have higher and very big reason. That's why you should say, or you should take what? Super omega-3. If you're looking forward to get pregnant, start it today. Are we together? I see a lot of introductions happening lately. Please make sure you start taking super omega-3. Are you together? So, conditions super omega-3 can help. Cardiovascular condition, neurological disorders, we talked about this, cancer prevention. I think these are the usual ones. We've talked about them earlier. Dosage. Adults can take about 2 to 3 capsules per day for general health. Even if you choose to take one anyway. Who has ever, okay, since morning, who has taken super omega-3? Just because we were not part of your people giving you water, I'm seeing so many hands. But anyway, congratulations to those who have actually taken. If you've genuinely taken, even if one, it contributes. Are we together? Then, for specific conditions like high cholesterol or heartbeat, do about 2 capsules, 2 to 3 per day. Children can do 1 capsule per day. Are we together? That is for those who can easily swallow. Monitoring and follow up. Don't let your people be. Be part of their journey. Walk with them. Understand that if their medication is supposed to take 10 days, By the 10th day, you're part of their journey. Don't go on the 11th day when you're looking forward for another team to go out of your what? Of your shelf. Okay? So for effective management, encourage participants to check their blood pressure often. Let them check, even if you're not part of their daily what? Checkups. Home monitoring tips. Use validative results. Understand optimal times to measure blood pressure. You cannot say someone has been staring up, from down, coming here, if you say, hey, most welcome, sit down and start taking their blood pressure. No. Let them relax for about 10 to 15 minutes after the heartbeat has reduced, and then that's when you can do what? You can take blood pressure. Because if you do it the other way around, it will give you false results. Are you together? And then you diagnose somebody and you refer them and do all it takes when they are actually not having high blood pressure. So these are some of the tips you can do on your follow-ups. Even advise them, health educate them. Tell them on how and what time they should take their blood pressure. Are you together? Okay. Protect, balance, and correct. There's a disclaimer here. And everybody should take note of this. That the Okata way of lasting health, supplements don't. Supplements never replaces your food. Someone should not convince you that take only a supplement and don't focus on the food. Are you together? They make your health complete. Are you together? And equally, don't replace their medication with supplements. Does that make sense? Don't tell them, leave whatever you've been taking, I have finally got a solution. No, that's not how it works. They work hand in hand. Everybody has pressure or blood pressure, but only how high or low your blood pressure is what matters. So that means even if they have blood pressure, you're not so sure about what has caused their blood pressure. It could be non-modifiable. Something cannot change. And you cannot tell them to leave their medications. You only manage up to when it is at the level of the recommended. So ladies and gentlemen, conclusively, take actions, be proactive, take steps in managing our blood pressure. Everyone, take steps in managing your blood pressure. And also, it is very important to do what? To educate others. Don't just use the information and go sit down. You can share it out in what? In groups. But again, we are going to give the floor for people who are looking forward to ask us a few questions. Those who have doubts, those who have something to add on. You are most welcome. Thank you so much. My name is Edmond Kayomtho, and I've been your presenter for today. Few questions, if they are available, we can always ask this.